guys, hi, welcome back to the next session of Unacademy. This channel is Unacademy Future Doctors and I'm your educator for biochemistry, Dr. Shivangi Shukla. I welcome all of you to this platform here. Let me just check if the live stream has started or not. Just give me a minute to check if the live stream is on. Am I visible and audible to everyone clearly? Can you guys see me and hear me clearly? Is my video and audio proper? Okay, great. So I'm Dr. Shivangi Shukla and I'm here with another MCQ based session before you guys. Back to back MCQ based sessions we are conducting. Okay. So now we shall be discussing a few more MCQs like we did in the last session. The rules are the same. I'll be providing you with 2 minutes for each question and you have to answer in the comments section, and then we are going to discuss the theory behind the topic. Okay, we are also going to discuss each and every option in detail. Okay, and this way you are going to develop the skill of elimination, how to eliminate options to arrive at a particular correct answer, especially in MCQs. It's very important, the skill of elimination. Now, the different types of subscriptions for NEET PG that are available on the Unacademy app, I'll just brief you about them. Both Iconic as well as Plus subscriptions are available, and both of them will provide you with access to video lectures from top educators across the country. Not just their lectures, but also the printed PDF notes, their question banks containing more than 25,000 questions, and the ease and the liberty of accessing these while on the go on any device of your choice in either the recorded or the live version. Okay, the Iconic subscription will also give you access to resources from Prep Ladder. So it is rightly called best from two of the best. Okay, now NEET PG has, Unacademy has come up with a revision batch for NEET PG students that is from March 16th to May 16th, and it is especially targeted for those students who are going to take this year's NEET PG examination in May 2022. It comprises of 8 grand tests, 19 subject-wise tests for each subject, and it will include lectures from more than 40 educators. Okay, so you can consider this as a last-minute rapid revision technique. Okay, and whichever subscription you wish to take, do not forget to put in the educator code DRSHUKLA Dr. Shukla to avail 10% discount on either Plus or Iconic subscription. Okay, so you can avail 10% discount on either Plus or Iconic, whichever you are planning to take, by using the educator code DRSHUKLA Dr. Shukla. Alright. So we have completed with quite a few questions. And now we are going about this one. Okay. Which of the following does not occur in starvation? Okay. Now you have to answer in the comment section. Okay. I'll give you 2 minutes for this to answer. Do not rush, but answer correctly. A. Ketogenesis. B. Gluconeogenesis. C. Hypercholesterolemia. Or D. Lipolysis. Okay, your time starts now. Come on, answer this. Hi Priyanshi, long time. Priyanshi's accuracy is 100%. All the answers that she attempts are correct. Very good. Super proud of you, Priyanshi. Are you an MBBS student or a NEET PG aspirant? Very good, Jatin. Jatin is another intelligent student. Okay, very good, Priyanshi. So you are also fresh with your biochemistry, right? You must have just taken your professional examinations. Very good. This is a great way. Students like Jatin, Priyanshi, they have just completed their first year, and I could not have imagined myself being so diligent. I was really not serious during my first 2 years because I had prepared super hard during my PMT. I was targeting that I will not take a drop year. So during 11th and 12th, I studied very hard. I've never been a hardworking student, but I what I used to do was I used to make last minute dashes. Okay, I used to study very diligently in class. I used to be very attentive in class in school. But after that, I did not used to study. I did not find studying very appealing. But during 11th and 12th, because it was once, I think the amount of hard work that I put in 11th and 12th, I haven't worked that hard for my academics ever. So during 11th and 12th, I had decided that I'm going to crack all the PMT entrances that I'm going to take with class 12th boards, and I'm not going to take a drop year. So I had worked really hard that time, so much so that I cracked my entrances with my boards, and thankfully I did not have to take, by God's grace, I did not have to take a drop year. So I was very happy, and then I decided that now, since I have entered college, I'm just going to relax. I was not at all serious during my first and the second year, and my only target was to avoid a supplementary, to pass all the professional examinations in one attempt without getting a year back or without getting any supplementary, which I did, thankfully, by God's grace again. But this is what I repent. This is what I have been telling all my students, not to take the first and the second year lightly, because they will form the basis. After that, I found it, I really struggled during my third and the fourth year because my basics were not proper. Okay, my basics were, I also struggled during my PG entrance examinations. I was really I used to study. I had to study a lot during my third and the fourth year because my basics were totally हिला हुआ, एकदम ही हिले हुए धुले हुए basics, because I had not studied during the first and the second year. I had only studied about 1 or 2 months before the professional examinations, and that too only the marked part, just to pass the examination. Okay, so that is what I repent now, because now when I read Robbins, that is pathology. Now when I read KD Tripathi for pharmacology, now when I read anatomy, physiology, biochemistry, I come across such good concepts that really add on to my clinical knowledge, and they help in my practice. So it is very important for you, and that is what I think. Had I known this earlier, it would have improved my clinical aptitude. So that is what I have been telling you guys, to learn from my experience, to people like students like Jatin and Priyanshi. They are such diligent people who have completed their first professional examination, and still they are choosing to attend these videos, these MCQ sessions, so that they don't lose touch with their first year, which is commendable. Really, you pat yourself on the back. Very good, Priyanshi and Jatin. This is how it should be. You should not be nerds. You should not be reading 24/7. You should enjoy your college life, because MBBS is something, because you will not enjoy your college life in post graduation. Post graduation will be more of hard work, slogging, and all. Your college life will only last till your MBBS. So enjoy it while it lasts, and at the same time make sure that you are working towards improving your basics. Okay, And your basics are, and it is very, very important that after you've completed your first year, in your second year, pay special focus to these two subjects that are pathology and pharmacology. Okay, pay special focus to these two subjects, and at the same time, to keep in touch with your first year, the best way is to solve some MCQs regularly or to attend lectures, MCQ lectures. Okay, and not full length lectures, rather MCQ revision sessions. So this way, whenever you come across something that is troubling you, that you cannot remember, you can quickly go back to your notes and revise that part. So it is a very good way to keep in touch. Okay, but do not keep on reading the theory of the first year again and again in the second year, because the second year is equally, if not more, important. Okay, yeah. So the correct answer here is hypercholesterolemia. Okay, now this can be answered with a little bit of common sense, because in starvation, if someone is starving, his cholesterol levels are bound to be low. Okay, but how do you explain it in from your knowledge of biochemistry? How do you explain it? What happens in starvation is, now the brain is a vital organ, and you know that the brain depends upon glucose 80%, and it can utilize ketone bodies for up to 20% of its needs. So, and the heart mainly depends upon, the heart is also a vital organ, it mainly depends upon fatty acids. So, during times of starvation, the lipids will be degraded. Okay, lipolysis will occur. Lipolysis means breakdown of triacyl glycerol to fatty acids, and these fatty acids will in turn be oxidized through beta oxidation to acetyl CoA, and if this beta oxidation is very rapid, then this acetyl CoA will go into ketogenesis. Okay, now these ketone bodies will act as fuel for the brain, so as to keep it functioning even in starvation. Okay, now what happens is, the substrate for ketogenesis is HMG CoA, and HMG CoA is also the substrate for cholesterologenesis, cholesterol synthesis. In the mitochondria, HMG CoA is acted upon by lyase. HMG CoA lyase to produce what? To produce acetoacetate, which is what? Which is the first ketone body to be synthesized. While outside the mitochondria, that is extra mitochondrially, this HMG CoA is used for cholesterol synthesis, the first step of which is the synthesis of mevalonate using the enzyme HMG CoA reductase. Now, this HMG CoA reductase is inhibited during starvation. Therefore, the whole of HMG CoA will be diverted towards the mitochondria for ketone body synthesis, and cholesterol synthesis is halted during starvation. And why is it so? Because the body does not want cholesterol. It is not vital for its survival. What is vital for its survival? It is ketone bodies. Because the brain can only utilize glucose and ketone bodies. Glucose is not forming. Glucose is not being taken up. All the gluconeogenesis has already been exhausted. All the glycogenolysis has already been exhausted. So now the body has turned towards ketone bodies. Okay, so this is how you explain it. Okay, now the next question. Which of the following are building blocks of fatty acids? A. Acetyl CoA, B. Acyl CoA, C. Acetate, or D. Ascorbate. Okay. Your time to answer has started. Come on, guys. building blocks of fatty acids: acetyl-CoA, acyl-CoA, acetate, ascorbate. Come on, come on. Last 1 minute left. Okay. So the correct answer here is A, acetyl-CoA. Now I'll help you to remember these processes. Please remember these definitions, okay? There are 3 levels. Acetyl-CoA forming fatty acids, it is called what? It is called lipogenesis. Formation of fatty acids from acetyl-CoA. Then formation of triacyl glycerol from fatty acids is called esterification. Fatty acids are esterified along with alcohol to form triacyl glycerols. Now breakdown. How will you remember the breakdown? Triacyl glycerols are broken down to fatty acids by the process that we already discussed, is known as lipolysis. And who will tell me fatty acids converting to acetyl-CoA is known as what? It is known as beta oxidation. Always remember these definitions. Very, very important for the MCQ point of view. Okay. Next. Which of the following is true regarding isoenzymes? A. They are forms of the same enzyme catalyzing the same reaction. B. They are forms of different enzymes catalyzing the same reaction. C. They are forms of the same enzyme catalyzing different reactions. Or D. They are forms of different enzymes catalyzing different reactions. Okay. Now a similar question we have already done regarding creatine kinase. So please try and recall from your memory as to what was the correct answer, and do let me know in the comment section. Okay, your time to answer starts now. Come on, last 1 minute left. Last 10 seconds left. Come on, guys. Try and recall about creatine kinase. What had we read? Creatine kinase, MB, BB. What are these? These are isoenzymes. So what is so special about them? Alright, the correct answer is they are forms of the same enzyme catalyzing different reactions because they are present at different sites. So CKMM is present in the skeletal muscle. CKMB is present in the myocardium, and CKBB is present where? In the brain. Okay, understood. Now whenever there is an insult or injury to the brain, there is increase in CKBB isoenzyme. Whenever there is an insult or injury to the myocardium, there is increase in CKMB. And whenever there is an insult or injury to the skeletal muscle, there is increase in CKMB because it is uh, 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 let out from its store in the skeletal muscle. Okay, like in rhabdomyolysis, there will be a significant rise in CKMM. Rhabdomyolysis means especially after crush injury, there will be destruction of muscles, which the muscle proteins will be rapidly secreted through the urine, which will cause injury to the kidney tubules, causing acute kidney injury. Okay, understood. So the same enzyme with different forms present at different locations catalyzing different reactions. Okay, the enzyme is creatine kinase, but its forms are different, present at different locations and catalyzing different reactions because it is present in different types of tissues. So different types of tissues will have different types of reactions which have to be catalyzed. Now contrast this with hexokinase slash glucokinase. Now hexokinase is present in all the cells, and this enzyme when present in the liver is called glucokinase. Now both of these, now you can see, they are forms of the same enzyme and they are present at different locations. This is present in all cells and this is present in the liver cells, hepatocytes. But they catalyze the same reaction, that is glucose to glucose 6 phosphate. So they are essentially the same enzyme and not isoenzymes. Okay, both of them are the same enzymes, just different names. But had they catalyzed different reactions, then they would have been called isoenzymes. Okay, next question. Which of the following is synthesized in the skin in the presence of UV light? A. 7-dehydrocholesterol, B. cholecalciferol, C. 25-hydroxycholecalciferol, or D. 1,25-dihydroxycholecalciferol. Okay. Do remember the synthesis of vitamin D by rote. Okay, you should be able to spell it out even in your sleep. Even when someone wakes you up in your sleep, you should be able, and someone asks you, even when you're groggy, if someone asks you about vitamin D, the synthesis of vitamin D, you should be able to blurt it out then and there. It is that important. Okay, so do let me know. Alright. Which of the following is synthesized in the skin in the presence of UV light? A. 7-dehydrocholesterol, B. cholecalciferol, C. 25-hydroxycholecalciferol, or D. 1,25-dihydroxycholecalciferol. Your time to answer has started. Come on, 2 minutes for you to answer. Come on, try and recall. Okay, last 30 seconds left for you to answer. Okay, so the correct answer is B, cholecalciferol. Now I'll just quickly let you know, because this is the last question for this session. After this, we'll take a break for 10 minutes and then we'll start with the next session. Okay. And after that session, we are going to have another session on the Unacademy app, special class at 11:45. So for all those of you night owls, you can join me there on the Unacademy app for another 1 hour long session of MCQs. Okay. So after this, 10 minutes break and then another session, MCQ based session on YouTube, and then at 11:45, an MCQ based session on the Unacademy app. All right. So I'll just quickly brief you. There are 3 organs where you have the vitamin D synthesis: skin, liver, and the kidney. In the skin, 7-dehydrocholesterol is converted to cholecalciferol in the presence of UV light. Okay. Now this cholecalciferol is then converted to 25-hydroxy cholecalciferol, which is also known as calcidiol. Because one all is this and one all is this hydroxy. So calcidiol. Now this calcidiol is circulated to the kidney, where it is converted to, in the kidney it is converted to 125 dihydroxy cholecalciferol, which is also known as calcitriol. Where are these 3 alls from? This is 1 all, this is 2 alls, dihydroxy. All is alcohol. Understood? So 7-dehydrocholesterol converted to cholecalciferol in the skin in the presence of UV light. Cholecalciferol is hydroxylated at the 25th carbon position to form calcidiol or 25-hydroxycholecalciferol in the liver. This calcidiol or 25-hydroxycholecalciferol is again hydroxylated at the first carbon position, forming 125-dihydroxycholecalciferol or calcitriol, which is the active form of vitamin D. It is also known as vitamin D3. 3 means 3 alls are there. Understood this? Now, if suppose there can be a question, if instead of 1, it is hydroxylated at the 24th carbon position, this also occurs in the kidney, it leads to the formation of an inactive metabolite. Okay, understood? Is it clear to everyone? Okay, now let us stop here. We'll break for 10 minutes and then we'll meet again in the next session of MCQ based discussion here on YouTube, on this channel itself, Unacademy Future Doctors. And do remember, you can go and have your dinner in these 10 minutes or even during class. And after that, at 11:45 late at night, for all the night owls, I'm conducting another MCQ based session, MBBS, on the Unacademy app as a special class. So if you guys have missed the classes in the evening, for those of you who like to study nocturnally, then you can attend those classes. The class at night on the Unacademy app. Okay. Bye bye guys, see you, take care, meet you after 10 minutes on this channel itself, okay, bye bye.